Welcome to Fast Applications of Neuropracticity, Part 20, The Invisibles. My name is Mike Studer, and I'm your host for this edition of FAN. In The Invisibles, we're going to talk about a potential cure in the commonality of these conditions. First, let's define the scope. We're talking about invisible conditions, difficult to image, hard to see what the problem is, and there is some incongruity in terms of where the condition lives, brain, body, both, absolutely yes to everything. We're talking about functional neurologic disorders, disorders of gait, movement, syncope, cognitive, and seizure, and so many more. We're talking about the invisibles, including dystonias, of which we could break down into focal hand dystonias, musicians, vocal, cervical, foot, and runners, persistent pain or chronic pain conditions, and persistent postural perceptual dizziness, which technically now fits up into the column or category of functional neurologic disorders. There is some commonality within these conditions, although they're not considered the invisibles per se. There are some differences on these. Again, in such a brief segment here, hard to go into all the details, but chronic fatigue, long COVID, some presentations, and post-exertional malaise have some related presentations and overlap in terms of physiology. Let's get into the important parts now. Last functional fast application of neuropracticity FAN, we talked about overcoming the invisibles, and you'll remember this vicious cycle. Then you'll remember we bounced in the solutions, if you will, for overcoming the invisibles. Let's spend just a little bit more time there. Cognitive behavioral therapy and acceptance and commitment therapy can be effective in learning what's happening with our mindsets, our mental pathways, and how to do some self-talk. Successes to see ourselves overcoming, especially when those successes come in functional task-specific contexts that have a measurable attribute. Education, knowing that I'm not the only one with this condition, and what is the unknown condition that I have. Then also within education, vicarious experiences, my healthcare team has seen individuals and helped individuals like me in the past. Then obviously, separately and in no specific order, play, music, that both of those should have a degree of autonomy. What gives me joy? In addition, some generalized movement that is near the context of my errors. If I'm having movement errors, again, exception to the rule there might be functional seizure disorders or otherwise. Perhaps some externally based mindfulness, not excessive interoception. And according to some recent research, visualization, meaning I am visualizing myself being successful, to be specific. All right, we understand that there's so much research that supports this. I'm giving you a few of them here. And then again, just reiterating, looking at some of the solutions that should be intuitive for you there. Again, thank you for watching. My name is Mike Studer. Follow future FAN episodes here on Instagram and YouTube.